So what we did is we looked at the patients treated on AREN0321 that had a diagnosis of focal anaplastic Wilms tumor and patients who were enrolled on AREN03B2 but not treated on 0321 but were treated similarly. And so we pooled those patients together when we looked at our analyses. The goal of AREN0321 was to intensify the treatment of focal anaplastic Wilms tumor for stage 1 and stage 4 patients. So stage 1 patients were historically treated with EE4A or vincristine and dactinomycin without radiation, and the outcomes were subpar for what we would expect within Wilms tumor. So the goal of AREN0321 was to intensify treatment for stage 1, and that was to DD4A or doxorubicin, vincristine, and dactinomycin with radiation. The treatment for stage 2 and stage 3 focal anaplastic Wilms tumor remained the same as a historic study, and that was also DD4A and radiation. And then we also intensified the treatment for stage 4 focal anaplastic Wilms tumors and metastatic focal anaplastic Wilms tumors to a revised regimen called UH1, which included the addition of carboplatin, cyclophosphamide, and etoposide to chemotherapy regimens with radiation. Based on the intensification, the stage 1 and stage 4 patients actually did markedly better than historic controls. All of our stage 1 and stage 2 patients had 100% event-free and overall survival. What we learned was that the stage 3 patients, although we did not intensify treatment on AREN0321, their outcomes were not to the level that we would have expected or hoped for. So we're looking to maybe augmenting therapy moving forward. The intensification of therapy for stage 4 patients, however, definitely moved the needle forward and should be how I would say a standard of care of how the stage 4 focal anaplastic Wilms tumor should be treated.